But, yeah.
A very good evening to everyone present here. I welcome all the participant doctors as well as the passive participant on today's session. Let's welcome today's speaker with great honor, none other than Dr. Quresh P. Maskati, sir. And let me share some of the achievement of this, sir. Sir has done MBBS, MS, DOMS, FCPS, FICS, and he is consultant ophthalmologist at Maskati Eye Clinic, Mumbai. And today he is going to discuss on a topic myths and facts on eye donation on the eye donation Fortnight. Before starting this topic, let me tell you overview of the topic. During eye donation for sight, displaying eye donation myth is essential. Contrary to the common misconceptions, donating one's eyes after death doesn't disfigure the body and can offer the gift of sight to someone in need. To know more about this topic, I would like to invite sir and highlight this some point of the topic in details. Sir, over to you, sir. Kindly proceed from here.
Thank you, Faraz. And my apologies for being late. It is Mumbai traffic, which is sometimes quite unpredictable. Without further ado, let's talk a few of the myths and facts which surround eye donation. Everyone knows it's very noble, but all of us are not quite sure how to go about it, how to actually execute it, whether it's difficult, whether it's time consuming. Let's go straight into the topic. Eyes are, when we talk about eye donation, the useful part of the eye is the front portion, like the watch in the glass in front of our watch, which is called the cornea. So you can see the picture on the title slide, where if the cornea, the front portion is opaque, we change it and put a new cornea there, and you get a crystal clear cornea and we restore sight. So it's not the whole eyeball, but it's only the cornea which is used. So that's the before and after picture that you will see. I will So first of all, why are we talking about this? Is there a need for eye donation? Yes. In Asia, over 1 million patients await corneal transplant surgery. Most of them, at least in India, children and young adults. However, the total number of eyeballs collected per year from India is only about 50,000. That's only 25,000 people donate eyes every year, which is a very, very small number. And it's estimated that for every eyeball which is utilized to restore sight, over 100 more patients are waiting for the same gift. Therefore, the eyes should not be buried with you. They should not be burnt, but they should be donated. So there is a real need. So is the whole eye used for transplant? As I mentioned earlier, no. Only the thin transparent layer which is in front of the iris called the cornea. You can see that opaque cornea in the picture there is used for transplant to replace the diseased or opaque cornea, as you could see, in the eye of the patient. So the patient is called the recipient. The dead person, the cadaver, your relative, your near one who donates the eye is called the donor. And that again is a picture of a clear graft. You can see those black lines, those are stitches, which are tenno nylon, which is very thin sutures, much thinner than a human hair. So does the human body reject the transplanted donor's cornea? How successful are corneal transplants? No. The human cornea, luckily for us, God created the human cornea without any blood supply. It's one of the few parts of the body, like the human hair, which doesn't have blood supply. Hence, the risk of rejection is very low because the body's white blood cells, which go and attack a kidney transplant or a liver transplant, they don't even know that a cornea has been changed. So they don't come and attack. And rejection, if it does occur for some reason, can be suppressed by just eye drops. You don't have to give very expensive or very heavy immunosuppressive drugs. Therefore, in general, the chances of success are greater than 80%. It's the most successful transplant in the body after hair transplant. You can see the pictures there, 2 years after transplant that it's looking, and the other picture, 20 years after transplant. You can't even make out that the cornea has been transplanted. What is new in corneal transplant? Earlier, we used to change the whole cornea. As you can see the eyeball picture there, the whole cornea and the central portion, which was opaque, was removed, and a new clear cornea was put in. It was called a full thickness transplant or a penetrating keratoplasty, as you can see in the picture next to that. But now we know that suppose only the upper layers are opaque and the inner layers are fine, we can do only what is called an anterior lamellar. Anterior means front lamellar transplant. And if the inner lining is bad, where the endothelium that you can see in the black and white picture, then we can change only the inner lining. So we can give the anterior part to one patient and the inner lining to another patient. So one donated cornea can actually be used to restore sight to two blind patients. What about those corneas which are unfit for transplant for some reason? Say the cornea itself is opaque in the donor, then we can't use it. Then they are invaluable for research and for training. We train youngsters, young eye surgeons on how to operate. So every cornea which is donated is useful. For some people, it is used to donate to restore sight. For others, it is used to for research and for training purposes. This is what I was telling you, that if the posterior lamella, the inner lining is used, if you see the top picture where we call DSEC, it's called decimate stripping, automated endothelial keratoplasty, where the inner lining, the cells of the endothelium and a little bit of the posterior stroma is used, that is DSEC. And if only the endothelium and the decimate membrane is used, that's decimate membrane endothelial keratoplasty, which is called DMEC. So DSEC and DMEC are two posterior lamellar grafts, and DALK, which is deep anterior lamellar keratoplasty, where the upper or the anterior 2/3 of the cornea is transplanted. So that's DALK, or anterior lamellar or deep anterior lamellar keratoplasty. So these are the two examples of lamellar keratoplasties. Does corneal transplant guarantee sight to all blind people? No. Transplants will only help when the loss of sight is solely due to corneal defects. As you can see in the first picture, the girl has got a cornea which is opaque. The middle picture, where the central cornea is opaque, of course you do a transplant, it will restore sight. In the third picture, that's the retina picture that you see, and the nerve of the eye that you can see, which is yellow-white, which is optic atrophy, or the nerve of the eye is damaged. It should be pink or red. So if the nerve of the eye is damaged, then corneal transplant doesn't help, or eye transplant or a donor will not help, because you can only change cornea. You cannot change retina or optic nerve. So how will the donation be used? Say my father has passed away. So the eye bank team comes, technicians come, and they remove the eyes. If the technicians are well versed, they will remove only the cornea with a little rim of sclera, or they will remove the whole eye, take it to the eye bank, where in the eye bank, trained technicians will cut away the cornea with a rim of sclera, as you can see in the third picture, and store it in a bottle with a pink colored fluid called MK medium, in which it can stay for 1 week. And if we want to keep the eye longer, we put it in a little more expensive medium called Optisol or Cornisol, where it can stay for 15 days. And then when we want to transport it, we put it in an igloo or ice box with ice packed all around it, so that it stays in that position for 24 hours, and it can be moved to the eye surgeon's clinic or to the eye hospital, where it can be operated on. So even if a patient is in Jumri Talaya or in Kashmir or in Kanyakumari, I can store the cornea for 15 days, not 1 day or 2 days as it used to be earlier before these fluids were discovered. So what is an eye bank? An eye bank is a link between the donor and the recipient or the eye surgeon. So it's an organization recognized by the government to collect the eyeballs. So they will collect it from your home or the hospital where the person has died, and then they will process it. They will collect the blood also. They will check for HIV and other things as per WHO requirements, and they will then deliver it to the next person on the waiting list who requires the corneal transplant. So how quickly should the eyes be removed after death? They should be removed as soon as possible, but the eyes can be removed up to 6 hours after death. However, if the climate is very hot, such as in most parts of India, the shorter the duration, the more healthy the cornea. So preferably 2 to 4 hours after death is ideal. Is it necessary to transport the donor to the hospital after death? No. The eye banks have personnel, the technicians, the doctors will come to the donor's home or place of death and remove the eyes. They will come by ambulance, in some places by cars, in some places by two-wheelers, and they will come no matter how rich or poor. You could be in a jaggi jhopdi, or you could be in a palatial mansion as it is seen. It doesn't matter. They will come wherever you call, as long as you give the correct address. So it's important to give the correct address. So who can donate eyes after death? Any age. Infant of 1 year, old woman of 100 years, all can donate eyes. Any spectacle power. It doesn't matter if the person who died had high minus numbers or high plus numbers. It doesn't matter because the cornea is being used. Any operated patient, even if the patient has had a successful cataract surgery, glaucoma surgery, retinal surgery, even a successful corneal transplant surgery, it can be used because the life of the cornea is 200 years. So a corneal transplant patient can also donate eyes. Just that the cornea has to be clear. That is the only reason. If the cornea is not clear, the cornea cannot be used. What about diseases? Patient is suffering from diabetes or high blood pressure, or heart problem, beer belly. As you can see, it doesn't matter. They can donate eyes. Any cause of death, vehicular accident, stroke, suicide, heart attack, even a cancer patient, all of them can donate the eyes as long as the cornea is healthy. So then it brings us to the question, who cannot donate eyes after death? If doctor is saying all these people can donate, there must be some contraindications as well. Yes, there are. So WHO has given contraindications wherever it's a viral cause of death, because cornea is corneal nerves and the virus can get into that. So deaths like rabies, or if there's generalized infection, very severe septicemia, then we don't collect. Patients with HIV, AIDS, we don't collect. If it's a blood-borne cancer, WHO forbids us from collecting. But most important we find is those whose relatives refuse donation. If they are fighting like this after the death of the donor, then there is no point. The technician is not going to come and make peace with the relatives. So any two relatives should be there to consent for eye donation. Doesn't have to be the immediate children or the parents. It could be first cousin from the mother's side or third cousin from the father's side. It doesn't matter because the closest relatives may be abroad. But as long as there are two relatives who will sign the consent form, that's all that is required. What about any religion? Does any religion forbid eye donation, as the monkey is saying over there? No, it's not forbidden in any holy books, as there was no eye donation practiced when they were written. The Bible, the Torah, the Quran, none of these had the eye donation at that time when it was written. So it's not expressly forbidden in any holy book. In fact, certain religious leaders such as Buddhist monks in Sri Lanka and parts of Thailand actually go from door to door propagating eye donation. And some Muslim countries like in Egypt and in Iran have actually issued fatwa. Fatwa means a holy edict by the religious leader calling for eye donation. So Iran has a very high rate of eye donation. So it is a lot of myths that some religions don't allow it. Nothing of the sort. What about the procedure? Is it cumbersome, time consuming? Then I don't want to do it because I'm in a rush to get my father buried or cremated. So if there are too many forms to fill, forget about it. No, it is easy. Almost no paperwork is required. So this is another myth which needs to be busted. How long will it take? In Mumbai, the eye bank team will reach within an hour, no matter what the traffic, because we have got 20-25 eye donation centers where there are people waiting to come. Procedure will be completed in 30 minutes. A little bit of blood will be collected at the same time. Is there any disfigurement of the face? Not at all. You see this lady, even the makeup is still there after the eyes have been removed. No one can tell that the eyes have been removed in this picture. So after enucleation is the process by which we remove the eyeballs. So the eyelids are gently closed after that. We may put some cotton or we may put an artificial plastic cornea there to keep the shape. So no one can usually tell that the eyeballs have been removed. A few ml of blood is collected from the vein or the heart for necessary testing. As per WHO, we have to test for venereal disease, for HIV before we release the eyeball. So there's no disfigurement. What is meant by HCRP? HCRP is Hospital Cornea Retrieval Program. So what we realized was that when people die at home, it's usually the elderly, 80, 90-year-olds. Yes, their corneas can be used, but in a hospital where people sustain heart attacks or they come with trauma, these are usually young donors. Younger the donor, the better the cornea. So our eye banks now Of course, we accept eyeballs from home deaths, but we try and motivate people in the hospitals to donate eyes. So it's a sustained efforts by all eye banks to collect maximum eyeballs from hospital deaths, such as accident cases and from ICCU units, because the quality of the corneas is usually better than from home deaths. So again, I repeat, home deaths is fine. We also put up notice boards and we put up literature in hospitals. What is the role that a family physician can play? If you're a family physician and you're listening to this talk, please promote with posters in the waiting room. Ask your nearest eye bank, they'll be happy to provide posters about eye donation. Those who ask you questions about the procedure motivated by the poster in your waiting room, have the pamphlets which are prepared by the eye bank on myths and facts about eye donation, like what I've told you, ready to hand out to them. It can be in various languages. These pamphlets can also be kept with reading material in your waiting room. So while patients are waiting in your busy practice, they can go through this. If you're more keen to help, the eye bank staff will happily train you, and even your technicians or medical staff, in how to ask the relatives of a deceased person for an eye donation, what is called grief counseling, and how to enucleate eyes from the deceased. You're more than qualified to go and do the enucleation procedure yourself. Our eye bank staff will train you. As an individual, if you're not an eye family physician, you can still talk to friends. Whenever I get the opportunity in a cocktail party or in my Rotary or Lions, I bring the subject to eye donation and how so-and-so donated the eyes and so-and-so helped two blind persons to see. So talk to friends whenever you can, sensitize them about eye donation, how easy it is. They will ask you questions. You will listen to my talk. You have all the answers. You can put up posters in your buildings, housing societies. You can distribute pamphlets to your neighbors. And more important, if a death occurs in your neighborhood and you come to know, you just mention eye donation to the grieving relatives and offer to call the eye bank and arrange the whole thing. So all you have to do, usually 1919 is the number, or if there's a poster there, they will have the nearest eye bank numbers. Find it out, keep it with you. Just call the eye bank, they will then take over. If you're a member of Rotary or Lions or any service organization, you can organize a club visit to the eye bank. So the club home will come and visit the eye bank. The eye bank person in charge, the eye bank director, will be delighted to show them around and answer any questions. They can donate money to the eye bank. They can sponsor one or more corneal transplant surgeries for the poor, and can arrange for members to sign pledge cards. Those pledge cards should not be returned to the eye bank. They should be kept with the patient and shown with the donor and shown to their relatives, preferably the younger relatives, and say that, look, after my death, please call the nearest eye bank. This is the picture of what goes on inside the eye bank, but we'll be happy to organize the visits to the eye bank. So I'm so happy that you've been listening to me. I thank you so much for your attention. And I hope there are questions which have been raised by my talk. I'll be delighted to answer these questions. I'll stop my screen share now so that we can chat a little bit about eye donation. Thank you so much.
Thank you so much, sir, first of all, for giving your valuable time and sharing your knowledge with us after having a very busy schedule, sir. We have catch you after a month, sir, on this platform, IGCP and Med Talks. Sir, I can see we have received some question from the participant doctors. If you allow, sir, with all your permission, shall we take these questions?
Please go ahead. Yeah.
The first question is from Dr. Suprabhat Guha. It is asking, is it necessary to take the donor to the hospital after death for eye donation or not?
Not at all. As I mentioned in one of the slides, you don't have to take the donor anywhere. Just give a proper address with landmarks. Let the landmarks be good. Once we received a call saying that please come, it is a small hut opposite the person who's selling mangoes in the vegetable market at Grant Road. When unfortunately, when the call came, it was 5 in the evening. By the time our eye bank team reached there, it was 6 in the evening. The mango seller had gone home, so we couldn't locate the hut. So it should be a proper landmark so that we can locate the place and remove the eyeballs. But certainly you don't have to transport the patient. Thank you.
Thank you so much, sir, for answering this question by giving example and making the understanding simplicity level, sir. As moving forward, I can see another question from Dr. Snehali. She is asking how a diabetic patient can donate eye. Is there is any point of view or
Yes.
not?
No, there is absolutely no reason why a diabetic, hypertensive, a person with cirrhosis of liver, any disease, they can all donate eyes because we are using only the cornea, the front portion, and that is not affected by diabetes. In the eye, the retina gets affected by diabetes, which is at the back, but we are using the front portion, like the glass in front of a watch, and that is not affected. You can use a diabetic cornea for a non-diabetic recipient, and there's no problem. Thank you.
Thank you so much, sir, for explaining it really well once again, sir. Moving forward, I can see couple of questions are there. Another question is from Dr. Avinash. He's asking, does eye donor disfigures the face or not?
As I showed in one of the slides, I showed a lady with makeup on whose cornea had been removed, and there is zero disfigurement. You can't even tell, even the relatives, if they have not watched the eye donation process, if they've been outside, when they come in, they feel that nothing has been done because we gently close the eyes after that. And there is no bleeding. There is nothing that you can tell that the eyes have been removed. Thank you.
Thank you so much, sir. We will be taking one last question from Dr. Anjaswina Sinha. She is asking how and what are the criteria to become the eye donor, like how to promote this thing.
Wonderful. So as I mentioned in the last few slides, what you do is first do a Google and find out which is your nearest eye bank. Talk to them, find out their telephone numbers and keep it with you in your wallet. So as and when a death occurs in your neighborhood, just call up the eye bank. They will come. All they want to know is that the person is actually dead. So on a WhatsApp also, you can send a picture of the cause of death certificate from the family physician so that they know that the person is actually dead. They will then ask you for landmarks. They will come there and collect the eyes. So there is no paperwork, just two relatives will have to sign a form which they will bring with them. Thank you.
Okay, thank you so much, sir, for answering all the questions, sir. As I can see, there is no more question from the participant end. But Dr. Snehali has written wonderful topic to be discussed and making these things common in our surrounding so that we can have avail the like person who is disability with eye can have access of this by giving this eye.
Thank you.
And she has really enjoyed this topic and given her point of view. Sir, like as we don't have any more questions, sir, with all your permission, shall we conclude this session?
Thank you. Yes, thank you. Thank you so much.
Thank you so much once again, sir, for taking out your precious time and sharing your valuable knowledge with all the participants, sir. Hope to see you again with different topics, sir, in coming time, sir. Till then, take care of